I am Chris Coles, I'm Belgian. I am an engineer by trade and I started my career at Master Foods. After a few years in sales and business development, I moved to BAT, British American Tobacco. 3 years later I joined Interbrew, the company that became Anheuser-Busch InBev. Spent 17 years of my career at Anheuser-Busch InBev. The last 10 years of my career I have been the CEO of several portfolio companies in the healthcare space. I have been the CEO of Harmonia, a elderly care provider and a portfolio company of Verlinvest. I have been the CEO of Cureos, a dental service provider and a portfolio company of EQT. And most recently I was the CEO of Medivet, a CVC portfolio company in the animal healthcare space. Today I am a non-executive director and the chairman of several portfolio companies of Verlinvest. I am the chairman of Faceland in the Netherlands. I am the chairman of Blue Dental in Italy and I'm the executive chairman of Sinomedica in Switzerland. So, my expertise is mainly in two domains. First of all, as I spent a lot of my career in fast-moving consumer goods, it is partially in fast-moving consumer goods, but the last 10 years I have been very much finding my ways in healthcare. So I have been running and operating in different geographies in healthcare operations. I am specialized throughout my career in restructuring, in scaling up and also in consolidating companies. A question that's often asked is, how can somebody who has done fast-moving consumer goods be successful in healthcare? Well, there are more similarities than differences. And if you take all the good things you can learn from fast-moving consumer goods, apply them in a healthcare environment, it is a winning combination. At this very moment, we see three key trends in healthcare in Europe. The first one is healthcare has become much more patient-centered. Patients are much more engaged into the whole process. We also see a lot of evolution in patient consent, in patient satisfaction. All these kind of things become more and more important for healthcare companies. The other thing is the role that digital plays. We see many apps coming into the healthcare space. We also see that the advantage of apps is that people can get a better service, that everything becomes much more transparent. Also the internet makes pricing transparent, makes treatments transparent. And the last big trend I would say is B2C. We see now more and more companies changing lanes and getting from B2B, moving that space into the B2C. Walmart, Boots, they all now start offering healthcare services directly to the consumer. The healthcare environment in Europe is facing significant challenges. The first one and the biggest one is obviously the availability of care professionals. And that's why it's going to be key to find and to maintain, to retain the talent in the organizations. The second challenge that we are facing is how to embrace all this technology. We know that regulators are always a little bit behind the curve. So can regulators follow and do they have the pace to introduce new policies, methods and procedures that allow technology to play the role it can play? And the last one is actually the resilience of the healthcare system. Will healthcare be affordable for everyone? The way I'm adding value is actually threefold. The first one is I want to share with the people in charge of the portfolio companies, I want to share my experience. And much more, I do want to prevent that they make the same mistakes I made. The second one is sharing my network. Often they are confronted with situations where I have been before, where I know somebody who can help them. And the last way of helping them is by sharing my toolbox. Very practical tools that I can offer them to help them bringing transparency, looking at solutions in the way that they can manage their business in a more effective and efficient way. The advice I have to give the most is stick to what really matters. Focus, hunt for the lions. Do what really makes a difference. And one of those things is obviously working with people. Make sure you have the right people. It is a bit the who before the what. And if you have the right people and you focus, make sure you have a plan. Make sure you have things transparent. Face the brutal facts, make a plan and execute. One of the lessons, for example, in running a company is make sure that you control what you can control. Look at your costs and do not overspend. So recently we had to restructure and right-size a little bit the spending pattern of one of the portfolio companies to make sure that all the money made in the operations wasn't wasted in the headquarters. More recently, I could share my experience and my network in a business where we had expanded into a new geography. The integration wasn't going fast enough and not as well as we would have hoped for. So I gave the CEO some leads in the country where the acquisition was done. He contacted those people and now we are back on track. Personally, I'm part of Verlinvest because of two reasons. The first one is, of course, I have had a positive experience with working for Verlinvest as a CEO of one of their portfolio companies. For me, it's important that I have a good relationship and I can trust the people I work with. They need to be professional and they need to be straightforward. And that's what I like about the Verlinvest people. The lessons I learned as an advisor was actually a lesson I learned when I was a CEO and I had a chairman who was trying to run the company. And that's not a nice feeling. So now as an advisor, I try to advise, I try to support. I do not run the company for him. The CEO has to run his own business.